We've got Taryn Fox, who's an OT from Hornsby Hospital. So Taryn, I'll bring you on and I'll get you to talk through your slides and how you're using the SMARTfit system.
So we received the pods, actually. We got the pods in January of this year. And we've mostly been using it across our rehab, outpatients and pediatric wards. So a big variety across the hospital, but it's been great for us. Our patients are really enjoying the technology that we've been using with them in the SMARTfit. And I guess what we use it for is our balance, neglect, cognition, and coordination. And we do see benefits across it all, really. And obviously other factors as well. We're just seeing great use of the SMARTfit system in the hospital. We have our OT assistants as well who help us set it up on a Wednesday, and it's sort of known on the ward that on Wednesday afternoon we're going to be doing SMARTfit, and a lot of patients tend to look forward to that. If we're seeing that it's a great benefit, we do tend to set it up a bit more frequently for some patients as well. So if you can see in our picture, we sort of have the stands that we set it up on, and then it just depends on the patient whether we have them standing or seated. And we also have the noodle there, which we've put a little thermoplastic head on it. Just for some of our patients, the tapping can be quite tricky for them. And then also we change the heights of the pods. So some are higher, some are lower, and just depending on the person's ability, whether they stand or sit to complete it. Some of our patients as well, their balance isn't great, so we tend to incorporate a walk belt, and that just allows us to provide an extra bit of security in holding them so that we prevent falls. We tend to make a list every week about patients that are suitable, and then throughout the day we bring them through. But what we're finding is that if someone's playing SMARTfit, the noises and that attract everyone, and we tend to have a bit of an audience that come and watch, and it creates a bit of an in-house competition, and it's really fun actually. We have a lot of joy playing it. We find that the families really appreciate it as well. They enjoy the technology use and the modern aspect of it, and to see their family members engaging in therapy, but in a way that's really fun and that it doesn't really present as a therapy to them often. So what we like about it is the versatility of the setup of it. So we can really set it up in a way that suits most patients, whether we have them all lined up on one level, whether we change the sizes of the pods. We do it on the tables as well. And I know with the pediatrics department, they have them spread out quite far so that the kids have to walk or run to touch the different pods. We use the graded approach. So for a lot of our patients, we start off with just the one screen lighting up, trying to find a smiley face or something quite simple. And then as they become more familiar with the game, we build it up to a more complex task. So we are using it on our phones at the moment. The Wi-Fi is a bit unreliable on the iPads. So we all the clinicians tend to have the app, and we set it up on behalf of our patients. And we find it really easy, and it's so convenient for us to change games or set it up. And so we're really enjoying that aspect of it. And the fact that it all comes compact in a suitcase, it's easy for us to move around and swap it between the departments if we needed to. So how our patients are responding to it, I guess we're finding that we have to take patients away. It's like once they come to play, they don't really want to stop playing it. And we're finding that patients are willing to engage in therapy much longer than they would with other activities. And then again, as I said, we have our little in-house competition, and a patient will have a turn and then watch someone else and say, oh, no, I think I can do better. So they'll want another turn, and they have the strength and ability to keep going with that. And yet the family's interactions as well. So how we feel that it's changed our therapy. So you can sort of see in the background, we sort of have 1 or 2 upper limb tables with quite old and basic activities. So we're really trying to engage the new technologies, particularly going into the new build as well. We're all just trying to build up our skills and knowledge. So we're really finding that the use of SMARTfit is so beneficial to us. And going into the new build, we'll already be so familiar with how to use it. Emma, our OT assistant, she's here.
Hello.
So she helps us set it up every week, and that's been a huge help for us because I know I can, as a therapist, I can make a list of patients who we think would benefit from it and what our goals are with them. And then if Emma sets it up, she can pull patients throughout the day. So that's been extremely helpful for us. And we also talk about the different setups and the creativity about how we can use it differently to engage our different patients. And again, we're monitoring our scores, and then we do the joint sessions with the physios and physio assistants so that we can engage the upper limb and lower limb as well.